so in this video, I'm going to be doing a sterile wound dressing change. So I'm going to perform hand hygiene when I walk into the room. I'm going to close the curtain for privacy. I'm going to introduce myself to the patient. Hi, Mr. Goldstein. My name is Peyton. I'm going to be your student nurse today. How are you?
Good, how are you?
Good? Okay, I'm going to be doing dressing change on your wound, but first, can you identify your name and date of birth?
Andrew Goldstein, 2/7/1992.
Okay, awesome. So at this point, you're going to drape your patient to where only the wound is exposed, okay? So now I am going to, I'm gonna ask his pain level.
It is about 5 right now.
Okay, awesome. So at this point, I'm going to put the disposable bag near the patient, on the patient. This is where you're gonna throw everything away. You're gonna make a cuff with it. Okay, so at this point, I'm going to put on gloves. I'm going to try to put on gloves. These gloves suck. Also, you want to make sure your patient knows not to touch the wound or the sterile field. So please don't touch the wound or the sterile field. Okay, so at this point, you're going to remove the dressing. I'm going to have you lift up your arm, take off the tape. It's really taped on here really well. I can't even see where it's taped. And you're going to remove the gauze and the wrapping. Remove the gauze and the wrapping. I have to think of what I gotta say. Parallel to the skin. And normally they'd be gauze right here, be a pad. You're gonna dispose of that in the waste. And then you're gonna dispose of the gauze and you're gonna fold it to make sure no liquid or anything like that falls out. So dispose of that. And I'm going to dispose of my gloves, inside out. Place them in the disposable bag. I'm gonna do hand hygiene. And then I'm going to place new gloves on. And I'm going to assess the wound for any drainage, inflammation, redness, anything like that. After you get your gloves on. Okay, so I'm gonna check the wound for any inflammation, drainage, like I said before. Looks good. Now I'm gonna take my gloves off again. And I'm going to perform hand hygiene once again. And then I'm going to come over here and I'm going to open my sterile field using one finger, like that. You wanna make sure you don't reach over the sterile field, turn your back on it or anything like that. So I'm gonna put my head down. Normally, you don't touch all over it. You don't want to touch all over it because it ruins sterile field. You don't want to reach over it like I just did. And then you want to take your sterile gloves. Do not turn your back on your sterile field. And you're going to open up the gloves. And you're gonna put the glove on your most dominant hand. You're gonna touch the cuff. Just like that. Don't worry about fixing it yet. And then you're going to take the one that goes on your less dominant hand, place underneath the cuff. Do not touch anything else because that will break sterile field. Okay, and now at this point you can uncuff them. And then you're going to take everything out of your sterile field that you're going to be using. And just imagine that this gauze is soaked in sterile water. Okay, so now I'm going to clean the incision, the wound. With each time you clean it, you want to use a new swab. So I'm just going to do it like this. Place in between your fingers. And you're gonna start from the inside out. And every swab, you're going to get a new one. Inside out. Okay. And then you want to make sure that you pat it dry. Okay. Then you want to dispose of that. And then you want to put a new gauze down. That's what's going to be touching the skin, the wound. And then you want to put a thicker layer of gauze on top for protection. And then you want to wrap your own. I'm going to have you lift your arm up.
Okay.
And you want to make sure that you wrap the gauze 2 centimeters above the wound and 2 centimeters below the wound. Inches, sorry. My bad. Inches. Okay. Make sure it's completely covered and protected. Okay. And at this point, make sure you're never turning your back on the sterile field. Okay. And then you're going to tape. Make sure not to get the tape stuck to your gloves, like I just did. Okay, make sure it's taped properly and secured. And at this point, you're going to put your initials on the tape and the date and time that the wound was last changed and cleaned. Okay. So now at this time you want to make sure that you remove any personal equipment that you used while you were changing the dressing. So that would include your sterile field, your gloves. You're going to dispose of that. Then you're going to remove your gloves. Actually, before that, you're going to ask for their pain level. What's your pain level?
I'm at a 2 now.
Okay, so you want to make sure that their pain levels are right. So you're going to remove the gloves and dispose of all of this. And after that, you want to make sure to document the dressing change. And then you want to make sure that you're checking the dressing every 12 hours or every shift for whatever it states to do for the dressing change. And that's how you do it.